Hi, this is Dr. Jen Peña, and I'm here to tell you all things sexual and reproductive health that are dominating your group chat. Welcome to Doom Scroll.
Hi, Dr. Jen. I'm really excited to talk to you today. How are you?
Hi, Lizzy. I'm well. It's nice to see you.
I wanted to talk to you about dating apps and how they're a key part of dating culture these days. One that stands out to me a lot is Grindr. It stands out like amongst dating apps in terms of being very sex positive and conversations around STIs. Can you talk a little bit about what Grindr is and why it's different than all the other dating apps?
Grindr works in a geolocation-based way to allow for dating and social networking, and it is targeted towards gay, bisexual, and transgender community. They're really making sure to partner with public health authorities, making sure that they're able to distribute information about STIs and STI prevalence. They're doing things like encouraging their users to disclose status of STIs, including HIV, even as far as to disclose whether people are on pre-exposure prophylaxis, for example, for HIV. They also have ways to not only disclose STIs, but also do partner notification anonymously, which I think is really great because there's a lot of stigma and shame still surrounding STIs. And so by allowing that partner notification, it also helps from a public health perspective to mitigate the rates of STI.
Grindr is kind of forward thinking in terms of a STI initiative within the app. What do you think is preventing other dating apps like Tinder or OkCupid from integrating something like this into their process?
They don't want to associate necessarily their brand with things like STIs and HIV. There's a stigma, obviously, still with anything related to STIs. And so these companies are concerned that their sites and their brands somehow might be tarnished by being associated with this health concept.
That makes a lot of sense and is actually really unfortunate because you would think that these other companies should have sexual health professionals on their teams, like guiding them, just trying to unpack the stigma around STIs. And by no means am I like celebrating STIs, but they're just a part of sex, and dating apps contribute to sexual activity. And so that brings me to my next question. Do you think that dating apps are contributing to the rise of STIs in our culture and communities?
Digital apps themselves don't directly cause a rise in STIs, but we can think about the fact that these apps are facilitating sexual encounters between individuals, that technically could contribute to the spread of STIs if people aren't following safe sex practices. Another thing is there's still a lot of this feeling of anonymity and disinhibition that comes for some users that are using dating apps, and that can in itself lead to riskier sexual behavior. But all in all, I think that these apps still allow for increased awareness and education. From that standpoint, I think that they're able to mitigate any potential increase in STIs because of increased sexual activity.
Thank you so much, Dr. Jen, for talking to me about this today. I absolutely loved this conversation and I cannot wait till next time.
Thank you so much, Lizzy. See you soon.